I'm not saying that Yazz's med era, which is my focus on this video, is as bad as a infusion era, IV push, medication by mouth, or intramuscular injection, or other type of patch. I'm just talking about the importance of applying lidocaine as prescribed. Social Nurse here. Over there on TikTok, Yazz's comment sections are on fire. People are making videos about that young lady. Listen, she made a huge mistake, right? Just even going live while passing medication and being on the clock at a job, right? At her job in the nursing home. She said that. She's a recent LPN graduate. She's been at her job for a month. She is a mother of 3 children. Not sure if a father is involved, but this young lady made a huge mistake. You know, I'm one of the people that hopes she really learned from this mistake and is given a second chance, right? The board will look at this. They will ask the question, what LPNs that are recent graduates and with the same experience as Yazz have made the same mistakes, right? Is it reasonable to think that LPNs similar to Yazz would have made the same mistake? You know, they're going to ask that question. Now, you don't see a lot of nurses posting while they are administering medication or on the job, on the clock. This includes LPNs or registered nurses or nurse practitioners, right? You don't see that often. Med errors can occur no matter what the level of education is, right? But the fact of the matter is there are people that have been given second chances that have done worse, in my opinion, than what Yazz has done. I'm not excusing it. That's up to the board. But lidocaine patches, let's just talk about that a little bit because they're absorbed differently. Not differently, but they're absorbed transdermally. But, right, the rate of absorption might depend on the person's weight, if they're obese, if they're muscular, if they're really frail and tiny, right? There is a rationale to why a lidocaine patch is prescribed the way that it is prescribed, right? The patches in the hospital have a little bit more medication in it, but even if you buy it over the counter, use it as directed on the box. Lidocaine is a numbing agent, and if used improperly, there could be problems. It could be toxic, right? Because it is a sensory medication. There's evidence-based studies that provide the rationale as to why it is important to use as prescribed or to use as directed on the label if you are not in the hospital. So to just dismiss it as it's just a lidocaine patch isn't a good idea, Social Nurse.